if there isn't background noise. So before we get started with our program, I want to welcome you all from Psychotherapy Action Network and tell you a bit about what we do in case you're new to us. We formed about 4 years ago to educate about and advocate for therapies of depth, insight, and relationship. We're an umbrella organization for both clinicians and organizations. Chicago Psychoanalytic Institute and Juvenile Protective Associations are co-sponsoring this event with us. They are two of our strategic partners, very valuable partners. This webinar is an example of one form of advocacy and education that SCIEN does. We decided that the current climate in which we're operating as therapists especially calls for the skills and insights that are well developed in therapies of depth, insight, and relationship, but they're not so often taught or utilized in training programs and settings. Our wonderful panel, which consists of Erika Schmidt as our moderator, and Karen Zilberstein and Nicole Tefera, are all members of SCIEN's Children's Committee and wonderful presenters. I know that you'll enjoy and be interested in what they have to say. I will introduce Erika and then she'll move us into the program. Erika is president of the Chicago Psychoanalytic Institute. She is a seasoned child analyst and therapist, and published in the field, and will provide a frame for what we're talking about today. Erika?
Thank you, Janice, and welcome to everybody. I'm going to reiterate what Janice said. If you're able to, and I understand my children taught me this, that not everybody is able to turn on their video, but if you're able and comfortable enough, it's easier to talk when we can see your faces. So it's great to welcome you back again for the third in our series of talks for interns and trainees. As you know, as the pandemic settled on us last March, we on the Children's Committee were talking about, you know, the impact on all of us. And I, in my role, one of my roles as an interim director of the clinics at the Chicago Psychoanalytic Institute, was very aware of the impact of this on our interns and trainees. And I thought, oh my goodness, what a terrible time to be an intern or a trainee. You know, you're so cut off from so many of the opportunities that make this such a wonderful experience. We thought it would be really useful and interesting to address these topics over the course of a year that follows sort of an internship year, and to talk about what we can and can't do using teletherapy, and being in the midst of this really kind of amazing experience of the pandemic. So that was our initial plan. You know, we didn't know the kind of social unrest that was going to unfold in the midst of this pandemic, and further affect certainly everybody in our country, and certainly people who are in the midst of their training. So we have, you know, in addition to this pandemic, this sort of biologically caused problem, we also have these social issues that have really come to the fore, and I think everybody is trying to grapple with. And of course, it was really brought home to us, was it last week, January 6th, with the insurrection at the Capitol. Sort of unbelievable events. If we thought 9/11 was unbelievable, we were really in for more unbelievable experiences. I think it's been really interesting to see how people have coped and what they've been able to do. It's been a very stressful time, and in the midst of all of this, I think we see amazing creative efforts to respond and to deal with the constraints and the anxieties of the time that we're living through. So we're going to try to address both sides of this today, the anxieties and the creativity and the possibilities. We're going to talk today about the middle phase of therapy in the midst of COVID, and our title is Learning to Work with Children and Adolescents in Time of Social Upheaval and Training Disruption. And so we're going to try to, as you can see, we have a broad topic or broad topics to address. The middle phase of therapy, of course, we think about it as the working through phase. This is when, when things really begin to change. It's a slow process, and sometimes it takes a long time. And as Janice said, these are therapies of depth, insight, and relationship, and they unfold over time. We also know that the training experience has very circumscribed time. So the middle phase for trainees, has a definite endpoint. So we're going to try to take into account all of these factors in our issues of technique, in our dealing with the pandemic, and in our dealing with social unrest. We have two wonderful speakers. They've been, with us since the beginning and have been tracing this process with us. And I'm very pleased first to introduce Dr. Nicole Tefera. Nicole is a pediatric psychologist at Advocate Children's Hospital Behavioral Health Services. It's a health center that serves the Southwest and South suburban areas of Chicago. She's an affiliate of the National Child Traumatic Stress Network and has a particular interest in the impact of trauma. And she also has a particular interest and a special interest in helping understand issues that minority populations face, particularly when dealing with trauma. Nicole is going to speak first today. She's going to talk about the impact on trainees and supervisors and interns in this time of unrest. She's going to think about social unrest, virtual learning, isolation, and the contrast between using teletherapy and our more traditional ways of thinking about therapy. So go ahead, Nicole.
Thank you for your introduction, Erika, and I'm glad to be here today. So I want to just kind of set the frame of my talk by just coming to you and speaking from a place of descriptors. So I'm going to come in the sense of my point of view is coming from a place of being a therapist, being a supervisor, being a mother, and being a Black woman. And all of these, I guess, descriptors of myself or what I identify or who I identify as, I think truly influences the work that I'm doing, particularly during the times in which we are finding ourselves in. And so, when thinking about the middle phase of treatment, as Erika mentioned, it's the working through phase. It's the time during which the therapeutic frame has already been set and established. It's the time when boundaries are particularly clear around the working relationship, and that safety and stabilization, particularly thinking about trauma-informed treatment, that there's a sense of safety and security and stabilization. And it's often a place where children have the freedom to continue expressing themselves either through play or through talk therapy, but the work becomes deeper and more meaningful in the sense that there's themes and ways in which you interpret what is being explained through play or through verbalizations. It's also a place in treatment where the clinician and the child's relationship is also deepening. It's also where you're observing treatment gains, where you're starting to see things turn around quite a bit. And there's a rhythm and flow about the middle phase of treatment. And so many of the core interventions or the ways in which one is tracking the treatment process live within this phase of treatment traditionally. And yet we're finding ourselves, and I'm finding myself particularly um, in phases of treatment that somehow feel unknown at times or unfamiliar at times. I kind of use the comparison of initially pre the pandemic and social and political unrest. I saw the traditional middle phase of treatment as being slow and steady. And and now I'm experiencing, and my externs are experiencing more of a choppier process, so to speak, as it relates to psychotherapy. And I really am able to link what is occurring in psychotherapy, um, correlate that to what is happening in our society. And so I want to talk a little bit about the ways in which I have noticed that these challenges are kind of are, penetrating into the psychotherapy process. And so, we've talked a little bit in the past about present societal threats, right, that are present, and ongoing. And it's almost as though
Careful, I dropped the plate.
oh, I think someone needs to mute. And so also ongoing, it's not almost as if, it's actually a fact that every time we come together again, there's something new that has unfolded by way of another assault, so to speak. And so every time something, whether it's the pandemic and the numbers are worsening, or whether it is, a new case that's being shown in the media with respect to someone being manhandled by the police, or riots and outbreaks that are taking place, or most recently an insurrection. And so each time something like this happens, I think it begs the question of, how do I, in the middle phase of treatment, acknowledge this, or check in with my client about how this is having an impact on their day-to-day functioning. And what does that look like for children? How are children and adolescents perhaps obtaining information, or feeling shielded, or standing before teachers who may be finding themselves dysregulated, and how are they negotiating all of the relationships that they're finding themselves in? And so, with that being said, I do think that there are some challenges to a child and a dyad's ability to feel deep, in terms of be safe to kind of go deeper in the work. And that's where kind of the choppiness comes in, because I do find that now there is this degree of, let's talk about what's happening within this week, and let's kind of ground ourselves in focusing on some of my child's behavioral difficulties, or the struggles that they're having as it relates to their chores, or following directions, or their school assignments. And so there tends to be this emphasis on being able to manage the child's behavioral functioning. And I'm finding the need to try and balance that with having the parent be appreciative of how the child may be trying to cope with all that they're being exposed to, but also having to hold and attend to how the parent may be feeling stressed. And so some of what I think is important to pay attention to um, in the middle phase of treatment that is kind of described as choppiness from my perspective, is to really find ways to perhaps have rituals and routines that whatever is happening within the particular week or particular day that a child is the life of a child is experiencing, that we still have this place that they come to where it's a opportunity for them to be able to feel as though they can express themselves, whether it's through artwork, whether it's through play, whether it's through the chat box in Zoom, whether it's through poetry, or simply talk therapy. And so some of the things that I have been more intentional about during this particular phase of treatment than perhaps I would have been as intentional about when in office and not in the midst of a pandemic and social political unrest, is really about establishing check-ins and rituals and routines, as I previously mentioned. And so what does that really mean in the life of being a Zoom therapist, so to speak? And for me, what that looks like and what seems to be helpful is really just having a period of being able to name for the child or adolescent that you're working with, being able to name and be open to naming that, wow, there's a lot going on. How have you been this week? And really just creating a space so that if they do want to talk about or play about it, what is actually happening in our world, in addition to what may be happening for them interpersonally, that they've been given permission at the start of the session to be able to do that. And that consistently occurs over the course of each session. And then within that, really being able to create a space for what are the highlights and lowlights from the child's perspective of the week or of the day. Perhaps they're wanting to focus particularly just on that day, that moment in time. And this is where I'm saying I'm being a little bit more intentional and structured than I would perhaps have been pre-pandemic. Perhaps it would have looked like when in office and pre-pandemic, it would have looked like, how would you like to spend your time today? But now it's looking a little bit different, and focused more on checking in at the beginning, giving permission to be able to talk about things that are happening in our world, and also given the space to be able to talk or play about that. Also, I'm finding there is a greater need for grounding work, and just getting a child or a parent or a teen in a place where they can be attentive and present in therapy. And I'm finding that these small tweaks have been helpful to create a place where some of the more traditional work can take place in the middle phase of treatment. So once we have kind of established these, routines and rhythms, and no matter what's happening in the world around us, that you have this place that is consistent, and this person who's going to show up consistently to be able to hold whatever it is that you bring, I think that is creating more of an opportunity to go deeper, and feel less choppy, so to speak. So routines and rituals, also, being able to normalize for the child, for the teen, and for the parent that, some of the reported symptoms that they may be describing may not only be a part of whatever their diagnosis is, but then it also may have to do with some of what is happening in the world around them. And so I think that there are times when parents, not that they forget, but when parents aren't considering that, oh, my child had a pretty off week this week, because they're preoccupied or maybe not even aware that they're being worried about things that perhaps they weren't worried about the week before. So it's like this thread of, there's these ongoing systemic or contextual factors that are moving through, while there's also this parallel treatment process. For example, let's say I'm working with a child who has ADHD, and so instead of everything being about in treatment, exploring and addressing symptoms consistent with ADHD, that it's also about integrating in real time some of the ways in which children and adolescents are understanding their own safety, how they're making sense of what they're seeing, how they're making sense of not only what they're seeing on the news and in social media, but also how do they make sense of what they may be overhearing within their household. And so, I do find that in addition to, providing psychotherapy services, there tends to be more of an increased need for parental support and being able to have opportunities to do parent consultation sessions, being able to offer or link families to case management services, because there are real concerns around finances, around food, around housing, just your assistance with daily living needs. And we all know that without some of these more primary and safety needs being attended to, that it's very difficult to kind of move into more higher level psychological thinking and processing that we are asking of folks during the therapeutic process. So I feel as though, this is just a beginning around us being able to dialogue together about some of the challenges that are taking place within the middle phase of treatment. But I also want to name that for the clinicians who are in training and within their supervisory relationship, really having the space to also be able to talk about how you as clinicians are impacted by what is happening in our world. And again, there is also a pandemic in place, and that is still happening, and there's lots of loss that's happening around us. And really, how does the intern or that is meeting with the supervisor be able to utilize that space to explore and think about how they're being impacted as human beings, and how that kind of maybe folds into the work that they're doing or not. And so I just want to also name that there are these parallel streams that are running in many ways, where the therapist and the clinician, not the therapist and the child, are having similar experiences, although there may be differences in their responses, or but that there is this kind of parallel that is running. So I am going to stop for now and give my colleague an opportunity, after being introduced, to share a little bit more specific as it relates to treatment, and then we'll have opportunities for ongoing dialogue. So thank you.
Thank you, Nicole. I just want to make a couple of comments.
Sure.
Because, you of course weren't reading the chat as you were speaking, but your comment about the therapeutic process being choppy really
Mhm.
struck a chord with people.
Okay,
So I want you to know that, and maybe we
thank
can
you.
talk about it during the question and
Sure.
answer period. I also want to emphasize something that Nicole ended with. She talked about the parallel experiences that the therapist and the child are having because we're all living through this pandemic together. We're all experiencing the, social unrest that feels like such a euphemism. I'm sorry about that, but uh, and the level of anxiety and the experience of loss and the uncertainty about the future, I think, are all a part of this for both therapist and child. And of course, and the vaccine, we didn't even mention the vaccine,
Sure.
which, is, maybe a light at the end of the tunnel at this point. But I do want to say something about the way Nicole began and the way she ended. And I want to link it to Janice's introduction, where she talked about the Psychotherapy Action Network as supporting psychotherapies of depth, insight, and relationship. And you notice that when Nicole began speaking, she said, "This is who I am. I am a therapist, I'm a supervisor, I'm a mother, I'm a Black woman." And,
Mhm.
she is aware of the identity that she's bringing in. She didn't mention, and I'm going to attribute this to her, but that she's in the middle phase of her career at this point also.
Good
Um,
point.
and I think, we think, as myself being someone who's more toward the end phase of my career, I find myself thinking a lot about that and thinking about the differences and I think about interns and trainees, of course, who are at the beginning stage of their career. It's, we're all dealing with our developmental issues as they play out in the therapy
Mhm.
process. So um, as Nicole said, we will have time for questions and discussion at the end. Feel free to use the chat for questions and discussion. And at the end, we'll also allow you to simply speak out. So now it is my great pleasure to introduce our second speaker today, who Nicole and Karen have been our trustee guides through this process. Karen Zilberstein, who comes to us from Amherst, Massachusetts. She is the clinical director of the Northampton, Massachusetts chapter of A Home Within, which is a national organization. It's a nonprofit and it provides pro bono psychotherapy to children who are in foster care. And I'm sorry, and children who have graduated from the foster care system. She focuses in her work on youth who've experienced foster care, adoption, disabilities, school problems, divorce, and trauma. And Karen's going to talk to us today about some of the clinical issues that arise in this middle phase of treatment, this teletherapy, as we use teletherapy, and as Nicole said, go into a little bit more specifics about the process of the middle phase and what one does. Karen.
Okay. Thank you, and thank you everybody who's attending. Yeah, I'm going to start. Every time I work with Nicole, she always gets me to think, which is nice. And I had a few thoughts that I jotted down while she was talking. I just want to emphasize a few things she said to begin with and say them maybe a little bit differently. I think one of the other things that is making this a hard time for interns, besides the fact that you're on telehealth, you're separated from your supervisors, everything's new, is that just as the events of the last year have really exposed the structural inequities in society, I think they're also exposing a lot of the limitations of our theories about psychotherapy and how structural inequities affect psychotherapy. And you are entering this world where people are beginning to grapple with that. And they haven't yet resolved it in our field. We haven't yet resolved how therapy is geared towards some populations more than others. And that's not just, in practical ways, in that some people have better internet access right now, or in other places that we know in some of the poor communities of color, they have psychotherapy deserts where they don't have the mental health resources they need. But it's also that our theories are really so Western and so rooted in certain styles of interacting and expressing emotions and theories of child development that are so Western that they also exclude people who aren't like that. And we know that in the studies that actually whites tend to remain in psychotherapy for the most part. I mean, these are averages, right? Because there's certainly people of color who get a lot of benefit from psychotherapy, but on average, whites tend to attend and stay involved more than other groups because it is geared towards them. So you're entering this field in a way where we have to grapple with so much about the way we work, including the idea that actually the socio-political environment has a big effect on people and needs to be addressed in therapy. And I think a lot of our models of therapy, and we talk about working through in the middle stage, it would be working through your own internal conflicts and ways of being and building skills. And what does that have to do with the socio-political environment? So you're entering this field in right now when we have to grapple with this, and your supervisors may or may not have experience in some of the areas that you have to now conduct therapy, and to really be thinking, how is the socio-political environment affecting my client, and not just what's going on internally for them. And we have to start now asking about it, right, with our clients, because we know that it's affecting them. So I do think that there is an interaction. So what are we looking for? After the first stage of treatment, we should have noticed certain patterns. Oh, the other thing I wanted to say before I get into that is that the middle stage of treatment, we are assuming that there is now a certain relationship, trusting relationship between the therapist and the client that's giving that holding environment, that's letting, we can go deeper because the client has some trust and can tolerate a little bit more. And I want to say again that parallel process, as Nicole was saying, that in order for us to hold our clients and give them that permission, we have to feel held ourselves. And it is so hard to feel held right now with everything going on. And that is something, you know, because everybody is being stressed. And on my caseload, the amount of stress that I'm seeing from clients, you know, is just skyrocketing. So we have to make sure that we are taking care of ourselves and getting the supports we need to be able to hold them. Because if we're not held, we can't hold them. And again, those mechanisms that generally held you with having supervision, having colleagues, you're somewhat isolated from that too. So I know we talked about that last time, but we have some different people. How do we deepen the relationship and the themes? I think that a lot of it has to do with noticing and pointing out the patterns. So in the beginning phase of treatment, you're establishing the relationship and you're beginning to notice patterns in what comes up verbally, patterns also, and I think really importantly, in how people react. Just going to give a sort of a much bigger example of one child that he's actually a teenager now, that I work with, has a really strong trauma history. And one of the things that we had to track in the early stage of treatment was when he was overwhelmed. And in the beginning of stage treatment, he couldn't even make it through a whole session often, and walked out a couple times, which at first I didn't understand what it was, or another time covered himself in a hood. So in the deepening stage, after we understand this, now I'm helping him to understand when he gets overwhelmed and what he can do about it, right? And we now have, we've developed the language of, oh, you got quiet. You know, first when he put his over his head and I got it, I said, you know, that's what you do when you're overwhelmed. Are you feeling overwhelmed right now? You know, you're labeling it, you're helping it. Gradually over time, when that's repeated, then you can say, what was it that overwhelmed you? Or what do we do about this? Or what do we, he was just overwhelmed. Now when he's overwhelmed, he just gets quiet. No longer hides, no longer have to. So we're expanding his tolerance and his ability to deal with it and to handle it. And the last time he was overwhelmed, I said, what do you want to do? You know, you're overwhelmed. Do you want to stop the topic? Is it too much? Have you gone as far as you want? You want to try to keep talking about it? He said, no, I can't talk about that anymore. I said, what would you like to do? And we started to listen to music together. So that was his way. And it was nice because in the beginning, again, he would disconnect from me when he was overwhelmed. And now we can stay connected, right? So we're beginning to expand that tolerance. We're doing the plan thing, we're helping. I think it's noticing patterns. When do they move away from you in therapy? When do they come close? Notice the body language, notice the emotions. What are the patterns in when somebody gets emotional? When do they look calmer? When do they get more? When do they get that look on their face? And you can say, did something just happen right now? And what are you responding to? Parents sometimes will get really, if you see a parent and a child together, sometimes you see the patterns in their interaction. A parent who can be very, very attuned and present for their child all of a sudden gets sharp. I had that happen recently, and you say, you know, that was a little bit of a different reaction that you gave right then. What happened? What triggered you? And you're starting to get people to talk about these and to go deeper into what's going on for them. Let me just, there's often, it's interesting, as the trust is growing, people are also, kids don't just, it's not a straight path. Actually, often this is the testing period. Sometimes you get testing right in the beginning, but sometimes the testing comes later when they feel safe enough. So negative feelings often come up that have to be dealt with. And a negative feeling coming up is sometimes a sign that things are going well, because these are questions and ideas that come up, but sometimes you have to handle the negativity, the child telling you you're stupid, you know, what's the language that they do that? You idiot, you can't, you don't know what you're talking about, you know, blah, blah, blah. Or some other negativity in behavior. Often we have to ask kids, you know, where did that come from? Or what did you expect me to do? It depends on the child, you know. The idea of deepening is that by now you have an idea of what the underlying issues are, so that you can understand the behavior or what comes up and be able to label it. So for kids who fear rejection, you can say, were you wondering how I would handle that? If that's something that you think happened to them and they're testing you to see how you would handle it, that may be one angle. Another would be to see if they can push you away. You know, are you wondering how I was going to react to that? What did you think I was going to do? Did you think, and you get some very good information if you ask that. One person said, I thought, you know, you'd go away. Oh, you're going to scream. Have you ever heard me scream? You know, what do you think I would do? Do you think, you know, abused kids sometimes try to provoke that to see if you will do that. So negative feelings, negative behaviors might come up that need to be addressed. And when they are, it actually deepens even more. Because when a child shows you, or an adult, those deep fears of, can you tolerate the negative side of me? And you show that not only can you tolerate it, but actually you're curious about it. It really starts to change that, and the trust is deepened. Curiosity is often, if you don't know what's going on, because if you're early in your career, even late in the career, we often don't know what's going on. Curiosity questions, what just happened? How come you did that? What did you think was going to happen? Are really good ways of addressing it. You don't have to have the answer. You really just have to have the questions. But keep an eye on the therapeutic relationship and what's causing rifts, what's causing them to relax and come together. I think that what the middle phase looks like can be different according to your client also. Sometimes insight and pointing out patterns is enough to do the change. Sometimes people actually need more help building skills. And especially if they have executive functioning difficulties, impulsivity, insight alone doesn't generalize well for people who don't have as good self-control, right? You're asking them to take the insight and stop and think in the moment, and they often can't do that. So for them, you know, the treatment plan might be more skill building, helping with skill building, practicing. And if it's a kid, you really need the parent on board. I've had some incredibly impulsive kids. A couple who the first thing out of their mouth is no. And it took a while, the parent first said, I think we have an attachment problem. A lot of these were adopted kids. I think we have an attachment problem. I think he's just, wants to be defiant, all these negative cognitions. But it turned out that it was just such an automatic response for some of these kids. And the mouth was working before the brain was thinking. And how do you change that when it's so impulsive? And then it's really, changing anything is really practice. So this is where you need parents on board to help with the practice. For these kids, one of my favorite interventions is the do-over. It's kind of like Who Wants to Be a Millionaire, where they say final answer and they get a chance to say yes, final answer, or to change it. To just never take the first thing that comes out of their mouth seriously, because that was leading to a lot of negativity. So to say to the kids, is that what you mean, or do you want to change what you said? And I have a kid now who still says, he's 19, he still says no really rapidly, but he's actually catching himself and changing it before we have to ask him. He goes, no, wait, so helping people also deal with what gets in their way and learning new skills. And there's lots of different ways of doing that depending on the person. I think what can be hard also as an intern is that you have these ideas and these techniques, and sometimes where you're placed has a different idea of what kind of therapy you're going to do. We're talking here about long-term therapy, and often it's going to be short-term therapy, and you don't have the ability to deepen things that way. Or you're being asked to do a very specific type of cognitive therapy, and the client doesn't like it and isn't responding well. And this was a question that had come up when we were discussing this. We have an intern on the committee who brought it up, which was a really good one. So when a child isn't taking to your intervention, what do? And how do you understand it? Is it just the person not being ready for therapy, not being ready for the type of therapy you're doing? Is it a sign that you need to go deeper? And so how do you know when you've got the right angle or not? And I think it's really hard when you are constrained by your placement and what you are told to do. But I think that all of these opportunities are opportunities to understand and deepen. So if a client isn't liking the intervention, and I think the thing to do is to find out why. What's going on? What do you think of that? We know one of the criticisms of evidence-based treatments is that it's a one-size-fits-all, and we know that people don't like it. Actually, evidence-based treatments, all the studies show how well they do, but if you look at the dropout rates, it's pretty high. So the people who complete it do very, very well, but there's a lot of people who don't like it and don't continue. So we do need to, the next thing, one of the trends in psychotherapy is personalized medicine, really finding the intervention for the person. But we do need to find out, you don't seem to like this, what's going on? What parts do you like? Can you tell me what's working for you, what's not working for you? And then you have an idea. And if you've gotten to know somebody, you can get a sense of that and what's going on, even how they might respond to sociopolitical, which was something before. So I know that you don't like it when we just talk. Talking is hard, you get tired, you get confused. Should we play a game while we do it? Should we do workshops? Should we worksheets? What would work better for you? And getting to know them and shifting gears. I think you have to have a lot of tools in the tool chest. You also have to know how much somebody can tolerate so that you're not pushing past it. So the question is, was it too much? And that you actually need to and give more breaks, or was it the wrong technique, or are they really just so done? I don't actually think psychotherapy is the right thing for everybody. And we can come back to that if you want later on. what I think that we wanted to just talk a little bit about short-term versus long-term. Short-term therapy is really good for people who have a very circumcised problem and they just need to get back on track. Life was going pretty well, something came and interfered, and they need to get back on track. They don't need to delve into a lot of things. It can also be really helpful if there's a specific skill that wants to be built. And actually sometimes long-term, more depth-oriented therapy can get in the way of developing skills because the skills aren't practiced enough, right? It gets diluted, and certain skills like self-control only work if you practice them over and over again. So very focused therapies on a skill, like if you're in the school setting and a child can't sit still or they can't contain their emotions and they need to learn how to calm themselves down, it can be very, very helpful because they can't do anything else before they do that. But there's a lot that's lost also because you don't get to learn all of the dynamics. You don't get to do what Nicole is talking about, which is to address what's going on in the world and how it affects them, and have people understand all the different aspects of them more, of themselves more. I'm trying to think, is there more that I was supposed to say, or are we opening it up?
No, I mean, if you have more to say, that's fine. If not, I'll wrap things up and open up for questions. Would you like, is there something you'd like to add?
I think let's have questions and we'll add them all later.
Okay, all right. Well, thank you very much, Karen. I'm going to take the moderator's prerogative and just make a few comments about what Karen has said. I don't think she used the word signals, but I think signals is a really good word for what she was describing. You know, you look for the child's signals about what's working, what isn't working, what they're responding to, what they're not responding to. And you know, she emphasized, and I'm going to underline her emphasis of this, she emphasized curiosity, and she emphasized practice. And I'm going to talk for a moment about practice, because I do think that in some sense that's what the middle phase is about. You know, you're practicing, and it's not just executive function skills that people practice. I think it's also those psychological skills. You know, how do you stop and reflect? You know, you've got to stop, you've got to think about what's been said, you've got to think about your own affective experience. You know, there's a practicing that goes to the building up of the kinds of emotional resources that we want kids to come away from psychotherapy with, whether it's short-term or long-term. You know, I fully agree that, you know, you can get things from short-term treatment and they can be very valuable to you. Karen emphasized curiosity, and she said that you don't have to know the answers, you know, and in fact, you don't want to be the one who presents themselves as the omniscient person who knows the answers. And I think then when you're confused, or when a child is saying to you that they don't want to do what you have to offer to them, I think, you know, they're your best guide. You say to them, well, what would be helpful to you? You're telling me that what I have to say or what I'm suggesting we do isn't helpful. So what do you think would be helpful to you? And that way of using the child or the adolescent as your guide for moving forward, for listening to their signals, for being curious about what they're telling you, I think, you know, I think that's what Karen is saying. And I also want to say something about our psychodynamic theories, or psychotherapies of depth, insight, and relationship, and how Western they are or Western they aren't. And I'll tell you that I've been very affected by, for the past 5 years or so, doing a lot of training of people in China, people in the Middle East, Saudi Arabia, Iran, New Zealand. So I've had some experience training people from many different countries, not all different countries, a number of different countries and a number of different cultural backgrounds. And I think Karen's mantra of curiosity really holds us well in those situations. If you are curious about who that person is, what their cultural background is, what the meaning of it is to them, how they respond to socio-political events, I think you're really in good stead as a psychotherapist. And, it doesn't matter, that our theories tell us that, kids are supposed to do this at such and such an age. That's kind of irrelevant in some sense to the basic psychotherapeutic process, which is how can I get to know and understand you and help you do what you want to do for yourself so you can be your best self. I think I don't mean to discount cultural inequity, systemic racism, the horrors that have been inflicted on people. If you just read about the Irish baby homes the other day in the newspaper, I mean, there are really terrible things that are done to people. And I think it's our job as therapists to be able to go there with people, whatever their culture is, whatever their background is, and they can teach you as you're doing this. And I'm not minimizing the differences, and I'm not intending to minimize the prejudices that are built into some of our theories, but I do think that an open mind and a sense of curiosity and a sense of who you are as you go into it, and an openness to other people, which I think both Nicole and Karen have really demonstrated today, I think will move you forward. So thank you, Nicole, and thank you, Karen, for your rich presentations. And I'm going to invite people to ask questions. You can do it through the chat, or you can simply speak up.
And while you're doing that, I'll just reiterate what you say a little bit, that, yeah, I think that we have to ask people, let's be curious. Curiosity is really the tool. And ask them how they're responding to what you're doing and saying. Be curious about everything. The way to get around bias is to just suspend them and to just ask. And the more uncomfortable you feel about tension in the room, the more actually you should be asking.
Right.
When you feel that tension, when something doesn't feel right, you can say, what just happened? Or is there something I'm doing that's making you uncomfortable? Is there something I'm saying? What parts of this, what's working for you here and what's not? And I start every therapy that way. After the first session and second and third, what parts of this is working for you? What parts of it isn't? Let's find our way of working together. And certainly when there's tension. To do that.
You notice how Karen is saying that she's letting the child or the adolescent be her guide. So questions, reactions, thoughts?
Ooh, I have a question that I could jump in.
Go ahead.
Okay.
Jump in. Thank you.
Yeah. So, something that I was thinking about, and I don't know how relevant it is, but it was crossing my mind in thinking about, especially in training clinics, where the mid area of treatment is also reminding of the end of the treatment, because it's not really an organic mid. It's a like, this is the middle, and it also is bringing in the end. And so what I found a lot with kids and adolescents is that it starts bringing up a lot of those anxieties of the like negative. I had a kid spend the entire telehealth session throwing balls at me and just trying to hit me with them. And then on the flip side, where adolescents are maybe more verbal, I've had the, well, I think I'm doing a lot better. And so maybe we should just go to every other week, and finding that the middle is bringing up a lot of the anxieties about the end. And so I guess I'm just curious about that from a training perspective, and how to kind of navigate those two things that are coming together, if that makes sense.
What a good question. Karen, Nicole, would either of you jump in? I'm happy to jump in too.
Sure. I just want to, I think it ties to the statement that you both have made about curiosity. And I would respond to the question initially posed by thinking about being curious with the client about what this time is bringing up for them, If they're remembering, particularly in training clinics, there tends to be transition from clinician, the client transferring from one clinician to the next. So it's almost as though there's this internal biological clock that begins to remind them of, okay, it's almost, I have a preview of what's to come. And so I do think that initially just being curious and noticing and wondering about the shift in the interactions that's taking place. So prior to, you know, the ball being whipped at you, or the client saying, let's decrease our frequency, that wasn't there before, but now it is. And so now, you know, being curious about that would be my initial response. I don't know if anyone wants to elaborate.
Karen, do you want to add to that?
I have to confess to not multitasking well and having been doing a chat during part of that. So
Oh,
I'm
well,
sorry. I'll leave it to you
okay.
guys.
Okay, well, you know, we're talking about the constraint, I think, on the intern and on the child, because the middle phase of treatment also is very close to the end. And I think, Rebecca, when you asked your question, I think you used the word organic. You know, it's not organic. It doesn't unfold according to the child's needs. It unfolds according to the, you know, training schedule. And that's hard on a child, and hard on an intern. And I think that, you know, for some people, you know, somebody who wants to come every other week, maybe they are feeling better, maybe they don't need the support, but maybe they're saying it's too difficult to deal with the ending, it's stirring up too many feelings, so I'm gonna retreat a little bit to a more safer position for myself. And sometimes you need to allow somebody to do that. And sometimes you can say to them, you know, I think endings are hard. And I think you're telling me that it's going to be hard for you. And in the past, you haven't had the support you've needed, but I'm going to try to give you that support and encourage you to think about how you're feeling. And you know, Karen made a mention of the negative feelings that come up toward the end. Those negative feelings about, I didn't get enough from you. This wasn't long enough. You didn't stick with me. You know, those are things that I think are realities to be dealt with. And I think that one, you know, the best response in those situations, I think, is to acknowledge what's going on between the two of you. Yes, you know, we got to know each other. We have been working well together. We've really started to understand these things, and now we have to stop, and that's really not fair. And, you know, let's think about how you might deal with that going forward, whether it's how you're going to use the skills that you've learned, or whether it's moving to another therapy situation. I think, you know, I think exploring those options is also important. But, you know, I think for the intern, it also brings up so much because, you know, this is, you've begun an exciting therapeutic experience with somebody, and you know, you want to continue, and you can't, and you have to move on, and hopefully you have a job to move to, and it's just a difficult situation. You know, endings, you know, the Romeo and Juliet line about partings are such sweet sorrow. I think it really captures a lot. We've done a lot. It's very sad to say goodbye.
I know we're going to talk about endings later in the year, but there are some kids who also would rather end it themselves than have you end it on them.
Mm-hmm.
And so they sort of take it and be in control. And so all of the things that Erika said is important too. One of the things, psychodynamic treatment often tries not to set limits on what kids do and say, and to be able to do it through interpretation and labeling feelings the way Erika said. I do think, depending on how much they're throwing balls at you, because I did hear that much, sometimes it is important to set limits. and to say, hey, I see that some really strong feelings have come up. And if the balls are soft and it's playful, you know, that's fine. But there is also a place to say, I know you're having strong feelings, you're showing it to me, but we got to make sure that nobody gets hurt. So let's just try to talk about it right now. Or can you show me in a different way? If you really need to throw something, there's a spot over there, or I'm going to put my teddy bear and you can pretend it's me and, you know, wail it at the teddy bear, but, you know, not at me.
You know,
Yeah.
I agree 100%. And I don't think it's untherapeutic, and I don't think it's unpsychodynamic. I think it's exactly what many kids need. You know, I'm not going to allow you to hurt me or hurt the things in this office. That's a boundary, that's a limit. You know, otherwise you can say whatever you like and you can do whatever you would like to do without hurting me, yourself, or the office. So I don't think we disagree at all on that.
I also feel like, you know, that question brings up for me, like the middle phase of treatment, triggering a preview of what's to come. I also think there's a place to really be able to, as you mentioned, after, you know, being curious, but acknowledging how difficult that may be, holding those feelings and staying with them, and helping the child or adolescent to understand that you're not there yet, and really being able to have them come back to the place of, this is where we are, and yes, we are heading in the direction like 6 months from now or 4 months from now or what have you, but to really kind of refocus them on the, you know, holding the anticipation, but also being able to help to perhaps ground them in the present as well, and utilize the relationship that's in the moment.
Yeah, thanks, Nicole.
Mhm.
Other thoughts and questions?
I have a comment. You know, I would say I'm almost in my, you know, last year of being a therapist myself too. Yeah, I work with infant and early childhood children. So I know Erika is talking about the importance of the signals, reading signals. I work with a lot of refugee family, Latino family, any kind of family, because I work at in a how can I say it, you know, in a health department in a community. So we have clients from all, you know, sources. So it's hard sometimes to read the signals when the child doesn't have the voice. Sometimes there is language issues, sometimes it's a cultural issues. I like the curiosity and the questions, because I use patterns a lot, because it's the only way that I can understand the context. I have a child, for instance, that he's in a special school now because he was so obsessed with the video games. He's very, very young, that he was, you know, saying he's Jason, I'm gonna kill people, I'm gonna kill myself. So they think the school thought that he was psychotic.
Mm.
So he has been hospitalized. He was in a psychiatric hospital. I feel myself that he was obsessed. Patterns from another culture, working long hours, didn't limit video games. And, you know, so it was a lot of psychoeducation with the parents about how to help the child to have, didn't even speak the language of the parent, only speaking a little bit the language, the English, instead of the language of the parents. So not feedback, not having anything. So I have him for several years now. He's doing much better. He is still sometimes still in the I would say fantasy world, but it's not so destructive. it's interesting. I think the signals is very important. I don't work with teenagers, but I work with young children. So you really have to use your observation skills, your, to read the cues using other means and build that kind of a strong. Usually work with the parents because, infant, early childhood children. So I want to only make that comment that this with different kind of developmental, even, chronological or developmental age, you have to use, other skills to really build the relationship and know how the child is responding, and also how to advocate with the schools. A child, oh, he's referred because he eat with his hands. I went to the house, everybody we eat with the hands. So not only that, it was other things too, but it was so culturally. So I was thinking what Nicole was saying at the beginning, the importance of understand the richness of the culture. You have the responsibility to be a cultural broker for the school. Because sometimes they don't have the opportunity. Now the teachers are doing more home visit, but but we, before COVID, because of the younger kids, I usually 90% of the time did home visit. So now it's a little more challenging, but I think we are learning through Zoom navigate, to some of the things. But I want to only make those comments about the difference between teenager and younger children. Maybe Karen also had that experience.
Yeah, you were making me think also of the difficulties doing therapy with younger kids over Zoom. And it can work very well, but it still needs a lot of structure, just like in the room needs structure. And one of the difficulties is that they move around a lot. If you're going to do play therapy over Zoom, they leave the frame, they're here, they're there, and I was thinking again about Rebecca's, when this person got mad at her and was throwing the balls, at least he was being very direct and letting her know they can just walk away if they get mad at you, right? In the office, there's some containment and you can deal with it. But if they really want to disengage, they can just disengage and there's no way to go after them, right? So there are some different things that have to be managed. And for a young child, you really need a parent present, which then there isn't necessarily the privacy that you could have at a different time. Although I often like to have parents involved as long as they're able to be so. But there are some special challenges.
Yeah. I think it's a really good point about parents, and we didn't really talk much today about parents, but you really can't do therapy with children, or I think adolescents, without understanding the parents and who they are and what they need and their relationship to the child, whether they're young infants or not. I want to make a comment. You didn't talk in great detail about your case, but I'm inferring something about it. And it really disturbs me when people label young children psychotic because they don't understand them. And, it sounds, again, I'm just inferring on the little bit that you said, but that this child had created a kind of world for himself because he felt like his world was barren. His parents were preoccupied in realistic ways, but and he had to create that world for himself. And once you begin to understand that with a child, I think you often see that kind of decrease in aggression over time that you're describing, because the aggression, I think, is often a response to feeling injured or abandoned or not understood. And once you're beginning to think about that with a child, I think it really goes a long way. When you're not trying to manage behavior, but you're trying to understand who they are, then, you've really got a handle on things, or a point of entry at least. I don't know, Nicole, do you want to say something about this?
I concur with all that you're saying. I do feel that really having the opportunity to dialogue with the parent is incredibly important, even pre the time that we're in, but also I think one benefit to being on Zoom has been because I'm not a home visitor, because I work primarily in an outpatient clinic, I have been able to kind of see into my client's world in a different way. And it has given me the opportunity to be able to speak about some of the challenges that perhaps the parent is raising with respect to the child's functioning or the concerns that the child has. And I think it's been more meaningful in the terms of having discussions about some of the barriers and challenges that have been faced. So I think I'll stop for there because I'll go to rambling.
Okay.
after a
You know,
minute.
we have, I think, a couple of important questions about,
Yeah.
Lindsay wanted to raise a question about socio-political
Yes.
issues.
Yes. And Nazish
And
has
I
her hand.
know that Nazish's hand is also up. So Lindsay, will you start? And then Nazish,
Sure.
you go ahead.
Thank you all for this important talk. One of the things that I've been continuing to struggle with, both as a therapist and as a supervisor, is how to hold a space and navigate with teenagers and with parents who may have very different feelings and opinions about the socio-political than I do. Ones who are very aligned with the people who committed the insurrection, and those who were very aligned against, new and ongoing rising questions about discrimination and racism in the country. And as a woman and a biracial woman, so many feelings kind of come up inside of me as I'm hearing people who maybe I've been working with for several years and have strong, loving feelings with, and now all of a sudden confronted with these other strong, powerful feelings. And as my feelings grow, my curiosity gets constrained a bit, and just having a hard time figuring out, of course, my parallel process is what I'm working through and those kinds of things, but I'm just having a hard time having a pathway in my mind for how to be with and what is it that I'm working on in some ways when parents who may not be coming to say, this is something I want to work on, or even adolescents, and yet there is this strong tension in the room, strong affects. Anyway, I don't know if people are having this experience or any kind of guidance or thoughts to give about. It feels a little easier when there's an alignment of some sort, but when there's such a dissonance at this time, it's proving to be quite challenging for me.
Yeah, thank you for raising that question. Karen or Nicole, do either of you want to start? You want me
Well,
to?
I just want to validate that what you're describing is an experience that many clinicians are having themselves, and really creating a space to be able to talk through, whether it's in supervision, whether it's in consultation groups, and really work with and grapple with, how do I, as a clinician who has a very different viewpoint and perspective and experience from my client, stay within a neutral way, except this feels different in some ways. And so I think it's really complex, but I just want to validate and say, for myself, what I've done is really be able to get additional consultation and support from colleagues who feel similarly.
I think that's absolutely true. As you were describing this, I just thought, oh, wow. But when you said that some of these are people that you've been working with for a long time and have loving relationships with, I just wonder if there isn't some way to talk more directly about it with them. You're speaking about something that I suspect you know that I might have a different feeling about. I'd like to understand your feelings, and here we'll go back to Karen's mantra of curiosity. I'd like to know about your feelings, but I'd also like to think about why you're letting me know about this in this way now, because, you know, you must know that it might feel jarring or hurtful to me. I mean, I think depth, insight, and relationship, you know, it's one way to work with and use the relationship. Go ahead, Karen.
I was going to say something very similar, at least the part of, I'm curious why this is coming up now in this way. And what that does mean. I mean, you're biracial. What do they, I might not say this hurts me. I might say, how do you expect, you know, I would feel about this, you know, I'm biracial, what was, you know, or something like that. But it is interesting that they would be letting you know when they know that you're biracial and that you might have different feelings and that they're actually espousing something that could be threatening to you. You know, so I think it is something really important to find a way in a non-judgmental, curious way to bring up and talk about.
And ideally, it deepens the treatment.
Yeah.
Okay, I want to make sure that we have time for Nazisha's question or comment. Oh, thank you, Lindsay. That made me.
I want to thank all the panelists. You know, this has been such a eye-opening session. I really appreciate it. I work as a home visitor, and I work with primarily Burmese and South Asian families, and I have a few Caucasian families in my caseload as well. My question is about the differences in what is considered appropriate in the American way of raising children versus other cultures. For example, the whole idea that you respect your parents and don't backchat. In the American context, it might be, well, we just have an opinion and we're sharing our thoughts. And in a South Asian perspective, it might be you're being rude and you're backchatting. Similarly, you know, the whole idea of don't question authority, right? Or we might think it's really inappropriate in America just to say yes, yes, yes to everything your parents say, but that might be highly appropriate somewhere else. So when we are thinking of solutions, how and I've heard everyone say and talk about curiosity, but when we are talking to very young children, how are we taking the cultural context of all these different cultures? How is, you know, are we specializing in a particular culture? Are we reading up more on our own? What are we doing so that we have a really thorough awareness of what is considered normal versus what we consider normal in the Western context? Thank you.
And what about the, you know, the fact that we're bringing one culture into another culture, and what does that mean that there are these differences? But anyway, go ahead. I'm sorry, go ahead.
Well, I agree. I think it's a really important question and a really complicated one, and one where we really have to look what we're doing in therapy, because our traditional techniques are going to be against that, right? We're teaching kids to have a voice, right? To think about what they want and to say it and to express it. And right, that's part of what we're doing. And that is counter to their culture. And we've become so, I mean, psychotherapy has come out of Western ways of parenting in a lot of ways. We've used that as a model. So I think we have to definitely start by talking to parents and educating and seeing what their goals are and aligning. And we have to be careful that we don't create that tension in the home. And of using techniques that are actually not going to work well for that family and it's going to put the kids in a very awkward position. Most of the world actually parents the way you're describing. Our ways of parenting, one sociologist has labeled it weird, Western, educated, industrial, rich, and democratic. And actually it's a minority of the way parents parent in the world. We ask parents to follow the child's lead, but in other cultures, actually the parent leads, right? There's a hierarchy and we're going for democracy.
Well,
so we need to educate ourselves. We need to, go ahead. Oh, did somebody say something?
I think Nicole wants to speak.
Okay.
Oh, I was nodding in affirmation. But I do also think that I really utilize parent time with parents you're talking about. So really trying to understand what the parents' goals are. How do we collaborate? What for them is their parenting style? What is their family culture of parenting? Because sometimes there's also differences within generations, within family systems. I was parented this way, but I want to parent in a different way for my child. So I think that there's a lot of conversation and discussion and dialogue that can happen as you prepare to engage in a dyadic treatment process with the parent and the child, so that you already understand and can respect and value the parent that you're working with and their approach, but also helping to provide them with information around child development and being able to respond to what it is that their needs are. And I often use the circle of security as it relates to attachment. And I think that, you know, myself and parents are able to collaborate and negotiate and kind of come back to the table when I'm seeing things differently than they are. So that's my response.
Thank you. You know, I want to.
Can I add one more thing to it?
Yeah.
I think that the more hierarchical the family system, the more you're intervening with the parents and you're talking to them, and you have to align yourself with the hierarchy and not try to undo the hierarchy. But I also think we have sometimes, yeah, there's a clash of cultures, and we need to talk to parents about the culture in America and how what they do clash and what they want to do about it. Their
Yeah.
kids are going to enter school and they're going to have another culture, and that can create a lot of tension in the family.
Yeah, I think that's a really good point. That, you know, there's a kind of negotiation when you're living in another culture. It really creates that tension. You know, I'm gonna, we're getting close to the end here. Janice wants to make some comments, but I would just want to say one thing. I taught development to clinicians for, I don't know, 10 or 12 years. And I always used to start the class by saying, many roads lead to Rome. There are many ways to raise children. And, you know, even if you look at the attachment research, you see that different attachment styles lead to secure attachments. There are many roads that lead to Rome. It's not that one way of child rearing is correct and one isn't. It's you know, there are a lot of possibilities, and I think that we need to respect that and keep that in mind as we work. So we are very close to the end of our time today. Before I turn this over to Janice, I just want to thank Karen and Nicole just a million times for their generous, interesting, rich presentations and their sharing their own thoughts and experiences. It's really been, I've learned a lot, and I hope that all of you have too. So thank you. And we hope to see you for our final workshop sometime in the next few months. So with that, I'm going to turn things over to Janice.
Well, let me second, Erika, your comments, and thank you to Karen and Nicole. This is wonderful, and I also have really learned a lot, and I suspect that others have as well. I just wanted to let you know that Cyan has a lot of different activities going on, a lot of different efforts going on. We welcome involvement. We particularly welcome involvement from those of you who are starting out in the field, looking for a home, and hope to provide that in many ways. We are, you should check out our website at cyan.org if you haven't been on it already. We have, one of the things that's one of our newest efforts is that we have a developing professionals committee that's forming, that's starting to look at a number of different things that address people who are starting out in the field in relation to our advocacy efforts. We're also thinking about a number of follow-up kinds of possibilities that would be extensions of these kinds of conversations. We're interested in your input and involvement. We're thinking about the possibility of starting book groups. So as you can see there, we've got lots of ideas. We need lots of people to carry them out, and we welcome you. I have taped this, so it will be posted, and I'll let everyone know when it's posted. If you want to go back to it or share it with a friend, it's available to anyone who wants to listen to it. And we are also going to send you a survey, and I know nobody clicks on those things, but please click on it. It's not very long, and it will help us to know how this went for you and give you an opportunity to contribute thoughts and ideas for our next presentation. Thank you all so much for coming. We'll hope that for all of us that things go well in the next week.
Thanks.
Mhm.
Thanks, Janice. We'll
Okay.
hope to see you in the next few months. So thanks, everyone. Thank you,
Thank
Karen.
you.
Thank you so much.
Okay.
Bye.
Bye-bye.